21-year-olds don't get lung cancer, and certainly 21-year-old Division I college athlete. It was incredibly painful, and I was very young and naive and had really no conception of what true pain was like. My entire childhood, my dream was to play Division I college soccer, and I was able to achieve that dream and was offered to play at East Carolina University in Greenville, North Carolina. And I got there freshman year, was in the best shape of my life, or so I thought, and started having issues with numbness and tingling in my toes. And I was unable to pass a fitness test that was required from the university. We started doing testing to try to figure out what was going on. I had nerve conduction study, MRI, chest x-ray, several other things, but nothing was really showing up. I eventually just said, well, maybe I'm making this up and maybe something's really not wrong with me. And so coach gave me a little bit of grace. I was able to still continue to play. But after my freshman year, I just decided, maybe I'm burned out. Maybe this isn't the right thing for me. And so I decided to stop playing soccer, which if you know anything about Division I college athletes, it's not easy to get to that level. And for somebody to just quit is pretty wild. Ultimately, I got involved in a sorority on campus, started, having fun, doing college kid things. And about a year later, I kept getting recurrent pneumonia. My mom had been trying to advocate for me 2 hours away because she knew that I kept getting sick and she knew that we had a family history. And she asked the doctor if he would please do a CT scan. And the provider pretty much told my mom, that she was being dramatic and that she needed to, not advocate so quickly or so hard for her daughter because, 21-year-olds don't get lung cancer, and certainly 21-year-old Division I college athletes. And so they agreed to disagree, and he did get a chest x-ray, and I was told from that chest x-ray that everything was fine, and I was handed a Z-Pack, and I was sent on my way. I ended up in the emergency room on a Saturday night at 11 p.m. I thought my appendix was rupturing. And they did a CT of my abdomen and pelvis. And when the doctor walked in, she said, your stomach looks okay. Your abdomen looks okay. Your appendix looks okay. You do have a cyst or two on your ovaries, but for somebody your age, that's fairly normal. But what in the heck is wrong with your lung? It was my sister and I. So we said, what are you talking about? And she said, well, you have a 4-centimeter mass and your left lung is almost completely collapsed. Are you having a hard time breathing? I was diagnosed with what they call a carcinoid tumor, which was about 4 centimeters in my left upper lobe. And at the time, it would have been considered stage 1B. I lost my grandmother, my great grandfather, and my great uncle to lung cancer. And so I guess I wasn't terribly surprised that this would come knocking on my door in terms of it being in my family. But as a 21-year-old, never smoking, former Division I college athlete, I certainly didn't fit the mold of, what you would expect for someone to get lung cancer looks like. When I was actually finally diagnosed, my mom reached out and got all of my records from everywhere that I had been seen. And we learned that the chest x-ray that I had that my mom had tried to advocate for, the radiologist that read it put in the note that further follow-up was recommended, and no one had told me. And so, unfortunately, that could have been an opportunity to get a quicker diagnosis. My mom and my dad both were instrumental in terms of getting a second opinion for me after I did have a confirmed diagnosis. I was being seen in my hometown of Wilmington, North Carolina. And at the time, there was not a fellowship-trained cardiothoracic surgeon. There was a general surgeon, and he was willing to take my lung out, but it wasn't going to be minimally invasive. It was going to be a large incision. And so thankfully, both my mom and dad had the forethought to, do a little bit of research and figure out where the best place for me to get care would be. And ultimately, I ended up at an NCI designated cancer center at Duke with one of the world's leading thoracic surgeons. At the time in 2007, there really wasn't systemic options for patients with carcinoids. So really the only treatment for a patient at that time was to have surgery. And so I was able to have a left upper lobectomy and lingula removed, the small keyhole incision that is on my left-hand side between two ribs, and then about a 2 to 3 inch incision underneath my left breast, which is actually where they pull the lung through. So fairly minimally invasive. And the recovery was very difficult. Not something I would wish on anyone. I don't think I was prepared for what it was going to do to me physically and emotionally. It was incredibly painful, and I was very young and naive and had really no conception of what true pain was like. And so that was a challenge for me. And then after the surgery, they said, hopefully, God willing, we'll get clean margins and we'll be able to, be done. And by the grace of God, I did have clean margins. And so ultimately, I did not have to have chemo or radiation. So I'm definitely one of the lucky ones, particularly given the fact that my tumor was as large as it was. I actually met Robert 2 weeks prior to being diagnosed with lung cancer. And so we had been on one date. I was in a sorority flag football league, and he was another sorority's coach that was coaching on another team. He could not stand the fact that they could not stop me when it came to sorority flag football. And ultimately, the way that we actually met was I dislocated my finger in the game against him. And after the game, he came over to check on me, learned what my name was, and then sent me a message on Facebook. And so his love is a testament of what true love really is. I'll never forget the first time he met my parents was at Duke. I was in the ICU, and he sent a text message and said, I'm coming from practice, because he is a high school basketball coach. And so he was in his workout clothes, and he said, I'm coming from practice, but I want to get there before visitation closes. He actually visited multiple times, and thank God slept overnight one night so that my mom and dad could get some actual decent rest. Early on, I really struggled. Initially I was scanned every 3 months, and then after year 1, they moved me to every 6 months. And then after year 3, I was moved to yearly. That's when I started to really struggle, because a year felt like a really long time. And, ultimately, I have 2 smaller ground glass nodules that are in my lung that have been there since prior to resection. And I was scanned until about year 13, I think. And ultimately, my physician, my PA, and myself made a decision that the risk of a CT scan did not outweigh the benefit of consistent monitoring, particularly because of just the repetitiveness of the CT scans and how many I've had. And so ultimately, I guess they would say I'm cured. And I think that, whatever happens to me moving forward, that there is a plan for my life, and that, I will be okay. But that comes from a strong faith. Just recently, I had some pain in my upper right quadrant of my stomach, and I was concerned. And so I went to the doctor, and they did an ultrasound, and they saw, that my liver looked a little enlarged. After the ultrasound, they were going to do a CT of my abdomen and pelvis to look at my liver. And I said, if we're doing a CT of my abdomen and pelvis, we are adding the chest on. And she kind of looked at me like, what are you talking about? And why are you telling me what I'm going to do? And so I had to go through the whole spiel about, I haven't been scanned in over 5 years. I have a prior history of lung cancer, but those kinds of conversations do stir up a little bit of emotion in terms of, always feeling like you're living with the diagnosis, even if it's 18 years past. No one, despite their lifestyle choices, deserves to have cancer of any type. And so, I've really worked to try to change the stigma associated with lung cancer. It's one of the reasons I've decided to be as public as I have been with my diagnosis. I've been really fortunate that, I've been asked to speak a fair amount. The first time I ever spoke, my physician asked me specifically, have you ever thought about advocating for lung cancer? And it was at my 3-month follow-up after my resection, and I was really struggling emotionally. I was just bummed. All my friends were on spring break, and I was still like to the point where I was having a hard time dressing myself. So like two totally different pathways for college kids, some that are on spring break having a great time, and me who like literally can't walk up a flight of stairs. So he said, we really need your voice. He broke me in easily, and he basically did a case presentation where he presented my case, explained that I was a Division I college athlete, and then went through the whole diagnosis, the surgery, the treatment, the whole 9 yards. And then he invited me up onto the stage to tell a little bit about my story. And I think it was just truly eye-opening for a lot of folks to see that somebody my age could be diagnosed. But that was the start of my advocacy. And so I got involved with many lung cancer advocacy organizations. And believe it or not, I actually work for industry now. So it's pretty cool, full circle moment for me. So we have come a long way, but there is still a long way to go. And I think the exciting things are that, we have lung cancer screening now, which we didn't when I was diagnosed. And so that in itself is going to make a big, meaningful difference for patients and their families. The key and the critical piece of that is that patients who are eligible to be screened have got to get screened. And that starts with not only patients being aware, but it also starts with clinicians and primary care providers encouraging their patients to be screened. And, for whatever reason, it's not the same as they view a mammogram or a colonoscopy or a PSA test. And so we've got to get providers to understand that just as they recommend a PSA or a colonoscopy or a mammogram, they should also be recommending lung cancer screening for those patients who qualify. The other thing that I think is really cool, the fact that there are now targetable mutations. So patients that have, ROS1 or ALK or EGFR or all of the ones that are out there, there are specific therapies that are available to those patients. However, it is shocking that there are patients who are still not being offered biomarker testing upfront at diagnosis. That should be malpractice, in my opinion. There is no excuse. The data is so clear that it says that if patients get the right treatment, they're going to have better outcomes. And so that's one thing that I hope patients and anybody that's touched by this or anybody that hears this, this story, I hope that they're able to advocate for their family or themselves to get the right test so that they can get the right treatment. My diagnosis has made me into an advocate for myself across the board when it comes to healthcare. I'm sure that some doctors are like, oh, Lord, here she comes, because I really am unwilling to take no for an answer. I've been very open about my journey with IVF. I think it's important to speak up about it because a lot of women struggle with it. But I wasn't having problems getting pregnant. I was having a hard time staying pregnant. I had 2 miscarriages, and I had to have a DNC. And after the second DNC, the physician said to me, I think you probably could try one more time, and then, we'll go from there. And I was like, absolutely not. This is painful. This is awful. It is horrendous. And the fact that somebody would ask somebody to do it for a third time without running a simple blood test, in my opinion, is criminal. I advocated for that, and he reluctantly ordered it. And ultimately, it changed my pathway. We decided to move straight forward to IVF. So I have Dottie, who is 3 and a half, and then I have Millie, who is 18 months. So they're 2 years and 3 days apart. I probably would tell her to buckle up. I would tell her, you got this. Whatever hand you're dealt in life, you can do it. I'm getting emotional. I feel like I have bloomed where I've been planted. Of course, I don't think it's the garden that I would necessarily pick. I don't think anybody wants to be in the lung cancer garden. But I feel like I have taken hold of my diagnosis and done as much as I possibly can to try to make a difference for others, so that if anybody has the unfortunate hand that I was dealt, that they might come out a little bit better or more educated or have a better outcome than some of the others that I've heard of and learned from that haven't had that opportunity.
If you were moved by this story, we think you'll also enjoy this one, which we've queued up for you right here on your screen. Also, don't forget to subscribe to the patient story right here so that you can be notified about all of our recent uploads. Thank you for watching. You are not alone.